Man, you guys are so attentive. And don't worry, Sherry, I won't tell what I saw.
What?
I won't tell about what I saw.
What do you mean what you saw?
That strange man giving you a kiss.
Oh. Eh. Eh. Eh.
Uh-huh.
Eh.
Okay. What is that? All right. So, abdominal pain. Almost abdominal pain. All right. So, Ashley, are you here?
I'm here.
All right. David, are you here?
Yes.
Dominic?
Yeah, I'm here with David. We're in Sierra Blanca right now.
Okay. Did Sophia make it back in? I know she was having some issues. Mr. Eric, are you in here?
Yes, sir.
And Ruben?
Who?
There you are.
Hey, hello. This is
Julio, are you back with us?
Yeah, I'm here.
And Luis, I see you. Arturo, you're here. Sherry, you're here. Ozzy, you're here. Tyler, are you in here?
I'm here.
And Velvet is here. Somewhere.
You heard me, right?
Yeah.
All right.
Yeah, I'm here.
And Victor, are you here?
What?
Velvet, you're here, but you're not really here.
I'm tired. Hey, Julio, you're at Socorro right now? Or Victor?
Yes, ma'am. What happened?
Are you at Socorro right now, or is?
No, Sanelli.
Oh, okay.
Yeah. Yeah, Chief is out, so we're responding for him.
He's out?
Yeah, he's out
He's
at
out?
Sam.
Huh?
He's out at Sam Houston with UMS. Yeah.
All right. So attendance is done. All right, so we're talking about abdominal pain and GI disorders. Very just short chapter. So we're going to compare and contrast the general characteristics of hollow and solid abdominal organs, list the general mechanisms and types of abdominal pain, describe pathophysiology, risk factors, assessment, and management of patients with emergencies related to hepatic diseases, including viral hepatitis, cirrhosis, and hepatic encephalopathy. Explain pathophys, assessment, and management of abdominal and GI disorders, develop an effective line of questioning for patients presenting with abdominal pain and GI complaints, communicate effectively, orally, and in writing the assessment findings, history, treatment of patients with GI complaints and abdominal pain. So, first off, GI disorders usually present with abdominal pain. Now, we have to be very careful when we're dealing with abdominal pain. There's a lot of different possibilities. And unfortunately, as you've seen, or if Miss Velvet would open her eyes, she could see. Just kidding. See, that's why I want cameras on, so I could see when you're falling asleep on me.
I was listening.
You're just resting your eyes?
Yes, but my ears are
Okay.
wide awake.
You were looking at your eyelids.
I heard abdominal and the gastrointestinal disorders, so I knew.
Okay. So I was saying that, remember, nausea and vomiting, just about anything can cause nausea and vomiting. So it's harder to tell when we have something going on. Okay. Why are you covering up your camera, Mr. Ruben Jaramillo? He's trying to be a bad boy. You can see the look on his face.
No, like I was gonna do something, but nah.
No.
But now you're in class.
I was gonna go to the bathroom. Yeah, I'm joking.
I see you wanting to cover up that camera. I see that covering your hand.
It was a mosquito. Yeah, like hey.
Uh-huh. Good.
Hi, Ruben.
It was like, oh, what is that? Yeah.
So with guys, there's a lot of issues, but with female, and some of you have heard this before, but there's thousands of possibilities of what could be going on with a female, or a female of childbearing age complaining of abdominal pain. So with abdominal pain, especially medical abdominal pain, I mean, trauma, it's kind of easy, just think about the structures, but with medical, you got to be a detective. You have to be, anyway, with medical calls, but with a medical abdominal pain, so you dim your light, huh, Ruben? So you never know who I'm going to put up on my board so I can see. So anyway, so with women, you really got to be suspecting a lot of stuff, and we'll talk about in the assessment what some of the questions are going to be. Now, some of the issues that we could have could be renal injury, could be a bladder injury, urinary tract injury, or problem. Like let me see, renal. It could be a kidney stone. We could have a UTI. We could have a blockage. We could have a tumor. We could have vascular disorders as a result, poor blood flow. We could have bowel obstructions. We could have a strangulated hernia. We could have ischemic bowel. We could have, or some of us can have, endometriosis, endometritis, something like that. It could be PID. It could be a yeast infection. It could be a bladder infection, again, a UTI. It could be a cervical injury.
Be a million
rough
things.
sex. Yeah. So you see all these different problems. Plus, it could be indigestion. It could be heartburn,
Cardiac.
cardiac. So there's a lot of different things that are going on. So,
Hey Lou,
yes.
do women have like? Is it more prominent that women have abdominal pain in heart attacks?
No.
No.
No, they might not present the same. They might not. They might be asymptomatic as far as the chest pain. They might feel more of general
Exhausted.
malaise. Yeah, feeling exhausted, feeling sick.
Okay, because I remember you mentioned something like that once about how the differences between men and women with heart attacks.
Yeah. Well,
And I didn't remember if like abdominal pain was one of them with women.
So, usually what you may have, and this is it really could happen to either one. Just because women usually don't feel chest pain doesn't mean they don't feel chest pain. Okay. But usually when you have epigastric pain, that's usually a sign of either inferior MI or a right-sided MI.
Which side?
Right?
Okay. Oh, okay.
Yeah, most of them occur on the left side, but there are some that occur on the right side. So you have you could be having an inferior MI, you could be having a right-sided MI. Okay, so as far as the abdominal organs, a little refresher here. So let's start with the right lower quadrant. What organs did you find there?
Your small intestines.
The appendix.
Okay, appendix, good.
The small intestines and the colon.
Small intestine, the colon, the large intestine.
The vein to the right leg.
What was that? I'm sorry.
The vein to the right leg.
Vein.
Well, that's what it says to the book on the book. Major artery and vein to the right leg.
Oh, okay. Which ones?
Femoral artery. For the heart.
And
inferior vena cava.
Further down, okay. Since you're reading the book, I'm not going to tell you no.
I didn't get that one from the book.
Okay.
Thought I was probably wrong, actually.
Go higher up, or actually go further down. How about you said the femoral artery? How about the femoral vein? What about but other than that, what else? Anything else? All right. How about the left upper quadrant?
To the left upper quadrant.
Spleen.
Okay, the spleen.
Part of the liver.
Do what?
Part of the liver.
The pancreas. Your stomach and your pancreas.
Okay. Now, is the pancreas considered a right upper quadrant organ or a left upper quadrant organ?
The pancreas?
Left upper.
Left upper, the right upper, it would be the liver.
Okay, but the
And I
pancreas
think
is actually
Oh, it's in
uh,
both?
pancreas is actually in the right, starts in the right upper quadrant.
really?
Uh-huh.
Oh, I thought it was left.
Oh, okay. Actually, it's saying that the pancreas is on both sides, the right and left upper.
I know it is, but
So it's in the middle.
primarily located in the left, but originates in the right.
So it's in both, but yeah, it's bigger on the on the left.
Exactly.
Okay.
So, how about the lower quadrant except for the appendix? And what's in the right upper quadrant?
Liver.
The liver,
Kidney and gallbladder.
kidney. Well, no, just remember the kidneys. Even though the book talks about the kidneys being on the left and right upper quadrants, they're really not found in the abdomen.
They're more posterior.
Correct. They're considered retroperitoneal.
Retroperitoneal.
Yeah. They're like located in the back. All right. So now, out of those organs, what are hollow organs?
The liver.
No, like your
No.
gallbladder.
What?
The definition.
What are they?
Is
What
it like
are
the
Oh,
hollow
is that? I'm sorry. The gallbladder. Yes.
like they have
No,
like
no,
bile,
I'm not.
not
Hold
actual
on,
blood.
time out. I'm not saying which are the hollow organs. I'm saying what is a hollow organ.
Oh, it's something that actually
They
has
contain.
bile or something inside, or it has leakage. It can form leakage.
Elastic and smooth muscle. Like it's hollow.
And they're hollowed out. And they contain fluids. So they can leak out. All right. Now, what are some hollow organs?
The gallbladder.
Gallbladder.
Okay.
You talking about just upper quadrants or lower also?
Kidney.
Bladder.
Okay.
Intestines and the stomach.
Do what?
The intestines and stomach.
The pancreas? No, that's solid merely.
That's all.
Okay. Oh, and what else? Can you hear me?
Yes, sir.
Yes.
Are there any other organs that are hollow?
Ureters.
Okay, they're not organs, they're tubes.
Okay, but it says hollow organs, but
Okay, hollow organs. All right, what's a solid organ?
liver.
It's vascular.
Here we go again.
Oh, what is
Vascular.
okay? Go ahead, Eric.
Vascular. That's what it is.
Solid organs are solid. They're usually vascular, very vascular. So give me some solid organs.
Liver.
Okay, an onion. What was that? I heard a high-pitched woman's voice.
I said liver.
Oh, hi, Jasmine. Huh?
Right. I was saying the spleen.
The what? I'm sorry. I couldn't hear you. You're very low volume.
She said the spleen, Lou.
Okay. Yes, the spleen. Any others?
Kidneys, pancreas.
Okay. So, any blunt trauma or penetrating trauma to the flanks can affect the kidneys.
Yes.
Blunt and penetrating trauma to the upper quadrants can affect either the spleen or the liver.
Yes.
So we got to think about bleeding. All right. So as far as the gastrointestinal system, we start out in the mouth, right? Goes down the esophagus.
Mm-hmm.
What kind of muscle comprises the esophagus? See what you did, Sherry?
What did I do now?
No, yawning.
Oh.
What kind of muscle is the esophagus comprised of?
It's gonna be a hollow. Smooth muscle, right?
Smooth muscle. What kind of muscle? Smooth muscle. So that means that the esophagus contracts. How? Okay, in other words, do we have to think about it?
Oh, sure.
No.
No.
No, we don't.
Voluntary.
It's involuntary. Good. Okay, gets into the stomach.
Somatic was involuntary or voluntary?
What was that?
The somatic system is voluntary or involuntary? I couldn't remember.
Somatic is involuntary.
Involuntary.
No. Somatic is voluntary.
Okay, because in the book, I think I'd asked that question, and then you said involuntary. In the book, said voluntary, like somatic, the ones you can control, like somatic. So I was kind of confused.
Sorry, say that again.
Just because I was confused about which one it was.
It should be somatic. Or somatic is voluntary.
Okay.
Because you got the somatic and you got the autonomic, right?
Yes. Yeah. Exactly.
And the autonomic is involuntary, so somatic is voluntary. Okay, so then the food, well, first off, it starts getting broken down by enzymes in the saliva in the mouth. Then goes down to the stomach where it gets further broken down, starts taking out nutrients. What is the... Actually, there's a sphincter muscle at the end of the stomach before it enters the small intestine. Do you know what that is?
What is it called? What did you say?
Cecum?
Sphincter.
Nope.
Cardia. Hiatum.
What was the question again?
What is that? What is that muscle called? It's the sphincter muscle.
The pyloric sphincter?
The what?
The esophageal sphincter.
Is it the pyloric sphincter?
Yeah.
The cardia.
Okay.
Sphincter.
The pyloric sphincter.
Pyloric?
All right. So once you get past that, you get into the small intestine. What part of the small intestine?
Duodenum.
Okay, and then after the duodenum?
Jejunum or yeah, I think that's what it's called.
Okay, and then finally?
Small intestine.
What was that?
The small intestine.
Well, we're in the small intestine, but it's made up of 3 parts, right?
Yes.
Okay. So we said the duodenum, the jejunum, and the ileum.
Okay.
Okay. Then at the cecum, that's the start of the large intestine, so it gets put into the large intestine. As we're going up the colon, what do we call that?
A semicolon.
Okay, the ascending colon. Then it crosses over. So what part of the colon is that?
Descending.
A transverse colon.
No, transverse, then descending.
And the descending, and then
The rectum.
the what?
Rectum.
The sigmoid colon. I'll be right back. Happy Sarah. Right there. I think she has to take a dump because she's crazy. All right. So there's a lot that starts going on. So what does the not the pancreas, we already know what the pancreas does. What does the gallbladder do?
Secretes bile. Or it stores the bile?
It stores bile.
And then it releases it into the liver, which then the liver uses it to do what?
Break up fat.
To help metabolize fats. Okay. All right. Okay. She's thirsty, but she still has water. Not much, but she still has water. All right. The abdomen does contain some huge blood vessels, and I don't mean in size. I mean very important blood vessels. So the first one would be the abdominal aorta. So as the aorta goes up, the aortic knuckle down the descending aorta, you get the thoracic aorta, and then you have the abdominal aorta. Okay. Obviously, we have the vena cava that's going up. We have the mesenteric arteries, we have the renal arteries and veins, and we have the veins of the hepatic portal. Where are the hepatic portal veins?
The liver?
In the liver. So remember that the liver is very vascular, and there's a lot of vasculature there. So if any of those get damaged, the patient's going to have some issues. Same thing with the renal arteries and veins. Remember that all the blood has to go through the kidneys to be filtered out. So you could have some issues in those blood vessels. Okay. All right. So as far as the colon or the large intestine, we talked about the appendix, the cecum. So the ascending colon, transverse colon, transverse, descending, the sigmoid colon, the rectum, and finally the anus. So sphincter muscles, you do have muscles down in the anus, and that's how you can pinch it off when you get a call. What do we call the substance that is created in the stomach that gets set down to the body?
Chime.
Chime, yeah. Okay. So as the chime is going through the large intestine, water is absorbed out of there. Now, just a little extra information: what happens when the person's constipated? Too much fluid was drained out, and so it's just kind of stuck there. There's no more lubrication. And so what the laxatives do is they help rehydrate that stool and expel it, help expel it. I know the EMT, was it? Yeah, the EMT's got this question. One way to think about the liver is your fuel filter. So as the blood is going through the liver, it helps process nutrients and medications. It helps metabolize and break them down, but also detoxifies the blood. So that's why you got to think about the fuel filter. In that, it's cleaning. It's doing some fine cleaning to an important source. As far as the kidneys, yeah, the kidneys do filter out the blood as well, but you got to think of the kidneys more as an oil filter, getting out large stuff out of there. All right. So we talked about some GI issues. Actually, we talked about some abdominal issues, but specifically GI issues. We talked about nausea, vomiting.
Just to show that the AirPods don't last very long uncharged or charged.
Good music, Calvin.
Where was I?
Sorry?
Good music?
Yeah, I saw that. I don't know where that came from. I didn't say that.
No, I said it. I didn't just say You just see his head bobbing, and like, good music, I was like, no, but he's like, what's that?
Oh, so it wasn't, you didn't see any type of transcription on your screen?
Who?
You guys.
No?
No, I didn't see anything.
No, we're just getting hacked right now.
They're gonna put transcription or what
It's
is
a killer wasp, so I don't take over the program.
Yeah, because I'm seeing there's the 15 people plus another 1,396.
What?
It's me and all my homies, Lou.
You have that many homies?
On Facebook.
Ouch.
Yeah, what, you want to doubt how many connections I have, Lou? Come on now. They call me Mr. Worldwide, Lou.
Okay, Pitbull, calm down.
How many of those ex-girlfriends that are stalking you?
Okay, what?
Pitbull.
Hello, you mommy. Oh, mommy.
Ruben. Turn off his camera. Vas a ver, Ruben, vas a ver. Anyway, other issues. I said nausea, vomiting, diarrhea, constipation, jaundice. Why is jaundice occurring?
Because of
Liver
the liver
failure.
malfunctioning.
High ammonia levels in the liver.
What high levels in the liver?
Ammonia.
What else?
It was like that.
Bilirubin.
How about there's a backup of bile? It's not getting processed, so it's backing up more bile,
Mm-hmm.
and it's putting into the bloodstream. What else? Back pain, rectal pain. You have hematemesis. What's the difference between hematemesis and hemoptysis?
One's coughing, one's vomiting.
So two different systems.
Mm-hmm.
Which one's which?
Well, one's respiratory and one's GI, no?
Yep, two different systems.
Boom.
Which?
Hematemesis is vomiting.
How do you know?
Emesis is vomiting.
There you go. It's hematochezia. What's hematochezia?
Hematochezia.
I'm gonna take a guess. It means sneezing on blood.
You what?
Sneezing blood.
No.
No.
What was the word, Luke?
Hematochezia. Chezia.
Blood in the gallbladder.
Huh?
Isn't it fresh blood through the anus?
In other words, blood in the stool?
Yes.
So what is it called?
Hematochezia.
So basically a GI bleed?
A lower GI?
Yeah, lower GI.
Must be hemorrhoids or something, right?
Basically, it's blood in the stool. Okay.
I thought that was, oh no, I was gonna say melena, but melena is when it's really, really dark, right?
Well, that's a coffee ground emesis.
No, but in the stool.
Oh, I found it on page 619. Hematochezia.
So, what happens, or what's happening, when the patient is coughing up bright red blood?
They have an upper GI bleed.
Okay.
Right. Ulcer.
No.
No.
No, ma'am.
Okay. Well, I know it's an upper GI bleed.
Okay, but tell me more.
Okay. Anybody want to step in?
Well, what was the question again, Lou?
The patient's coughing up bright red blood. Where is it coming from?
Oh, Velvet wasn't right? I thought she was right.
It is, but I want more specifics.
From the esophagus.
Okay, and?
Oropharyngeal down to the esophagus.
You what?
Oropharyngeal to the esophagus.
Okay, there's bleeding occurring there. Tell me more.
Won't it be like the veins in the esophagus? Acros veins?
It could be caused by cancer too, no?
It can, yeah. So somebody like Ashley that parties it up, and Sherry, they party it up too much with that Everclear or Rum 151.
Fireball.
I don't know about Fireball. I don't know what proof it is, but Everclear and Rum 151 are like very potent. So wears away the lining of the esophagus. Same thing for the bulimics that vomit, that force themselves to vomit. All those stomach acids coming up, they wear down the lining of the esophagus. So they're called the esophageal varices. So, with that said, why is it bright red?
Because it hasn't been digested yet.
It's an active bleed.
I wouldn't say digested, but so much. But you're right. And Eric, you said it's an active bleed. Yeah, there's blood coming off of those esophageal varices or the exposed veins, esophageal veins. It hasn't gone down to the stomach and been processed by the gastric acids. Because once you have it processed by the gastric acids, what color is it going to be?
Black and tarry once it's
Dark red to
processed.
black.
It's going to be dark red. The dark tarry is coming out of the butt. But it is going to be dark red blood. And again, coffee ground.
That's it. They're vomiting it up, right?
What was
They
that?
haven't processed. If they haven't processed it, it's going to be coffee grounds. If it
No.
hasn't,
If it's
No?
dark red, whether it's coffee ground or anything, it's been processed by the stomach acids. If it's bright red, it hasn't gone into the stomach.
okay. So the coffee grounds, are they vomiting that, or is that
Mhm.
what? Yes. Okay.
Yeah, that's located within the stomach.
Okay.
Now, you mentioned ulcers.
Mm-hmm.
They have bleeding ulcers. Has it been processed by the stomach, or has it been in contact with the stomach acids?
Yes.
Yes.
So that's where the coffee grounds come in.
Mm-hmm.
Okay.
Now let's go to the other end.
Mm-hmm. Go ahead.
It's bright red. So what's that indicate?
So if bright reds goes to the anus part,
Give me more. I
It's
mean,
a long
even dark red
ugly.
is the anus part, and we don't call it anus part. We just call it anus,
okay.
or butthole, or cornholio.
Okay. So let me ask you, if it's dark red, is it lower in the GI tract? If it comes out tarry, it would be a little bit higher in the GI tract? No. Would it?
Well, in a way, yeah, because it's traveled further.
Okay.
To be processed more by the body.
Okay.
So if it's bright red, blood coming out of the anus, would it just be hemorrhoids?
Exactly. And it's the same thing. It's burst blood vessels in the rectum. So you have to be careful when you're in the toilet and you're like, who does number 2 work for? When you're straining very hard, the blood vessels in the rectum to swell up and even rupture. Or as Paul would say, I like to take it up the butt a lot. That's why I bleed.
I knew it.
No, sorry to disappoint you. So yeah, it hasn't been processed by the rest of the GI tract. Now, if it's dark red, it's been processed by the GI tract. So again, when you have bleeding, if it's bright red, it's most likely caused by hemorrhoids or some sort of rectal trauma. Again, literally, taking it up the butt. Or will be professional. Sodomy
Okay.
or other objects. Rabbits, long john black silver, or some, I don't know. What, no courtesy chuckle? Jeez.
There you go, Sherry. Good job.
It took a while to process.
Oh my goodness.
I guess I should be careful. It is recorded, so. But yeah, rectal trauma can also cause bleeding, bright red bleeding. So just remember, if it's dark red, it's been processed by the GI tract, so it's somewhere up in the GI tract, in the intestines.
Hey Lou, I've had some calls where it looks like, or it is bright red blood, but it looks like caused from alcohol. Where I've heard multiple patients. I probably had like 3 or 4 calls where the guy, it's normally a guy calls and says that it's been, the only thing he was doing prior was just drinking a large amount of alcohol, and then he went to the restroom and he noticed there was a lot of bright red blood.
That kind of explains it. Blacked out and he took it sodomy-wise.
That's the only way?
No, I'm sure there's ways. No, but I'm thinking because it's going to damage the liver. And one of the reasons that alcohol affects the liver is we were talking about glucose earlier. Well, alcohol is a cleaner burning fuel, so the body loves it even more. Okay. It's like giving diabetic a candy bar. Oh man, that's so awesome, right? Because a lot of times you don't need a candy bar, but now you're getting it. Candy, right? So the body really likes that sugar alcohol, or that alcohol sugar, whatever it is. And so it stores it in the liver. And all that sugar damages the liver. Cirrhosis, okay? So eventually that can cause bleeding and it come out dark red. So the only other thing, and what I was saying is, no, there's other causes too. What I can think of, although I don't know if this guy is the kind of guy to do that, but college kids do weird things instead of actually getting an well, I guess they are getting an education. They learn new ways to ingest alcohol and get drunk quicker. They'll soak tampons in alcohol and they'll shove it up their butts and it goes directly into the bloodstream. Whereas if you drink it, remember the third pass metabolism?
Yeah.
It takes a while to kick in, but when you absorb it through the rectum, since it's very vascular, it gets in the bloodstream a lot quicker. They get drunk a lot quicker. So for you parents paying for college education or saving up for college education, just think about what they do with that education.
Yeah, man. Butt chugging Svedka.
I'm kind of curious now how you know the term.
Uh-oh.
To butt chug?
Mm-hmm.
You telling me you've never been in a party at Las Vegas, Lou?
No, actually, I haven't. I've been to Vegas. I've gambled in Vegas.
Well, let me say, you'll witness a lot of shit, man.
Oh, I'm sure. Remember, though, what happens in Vegas stays in Vegas.
Exactly.
But, so yeah, Eric, that's the only other thing I can think of. Whether it's something else, honestly, I'd have to research to see what else. But usually the stomach juices and the intestines will take care of the coloring.
Yeah, I don't know why. At that time, I just thought about it now, but I always thought it was just maybe a lot of alcohol. And then you know how they take like aspirin or acetaminophen for the hangover. I was thinking maybe they just took some of those. Most of the time, it's been like a hangover phase. So I just thought maybe they were just dealing with that, irritating the stomach.
Yeah, very well could be, but what else was I going to mention? Yeah, I'll have to look it up, but yeah, it doesn't really. I can't think of anything else that would cause it, unless somebody else has an idea, but I can't think of it. All right, as far as our assessment and management, in the scene size up, you want to look at your patient, see if you notice anything, although that's more of the general impression, which would be the primary assessment. You know, what do they look like? What's their facial expression? Are they showing signs of pain? Because remember, that's all subjective. They could tell us that they feel sick. Oh, I know what I was going to say earlier about, does Tylenol really work for hangovers? Maybe the headache, but
No, not even the headache.
yeah, somebody just outed themselves out as an alcoholic. But no, you got formaldehyde in your body, and that's what's causing the hangover. So as far as care, again, you want to look at how they look, the headache. Do they have the look of pain on their face? What's their color like? Are they jaundiced? Are they red? Are they pale? Are they, especially with abdominal pain, what's their positioning? Are they in the fetal position? Like, oh crap, that really hurts. And with abdominal pain, they tend to get into the fetal position because the pain is so severe that just bringing the legs up helps them out. What else? What's so funny?
Never mind, I'll tell you later. I promise. Sherry.
I figured it had to do with her.
Wow.
Check for hypovolemia on the patient. So maybe think about orthostatics, especially like Sherry and her drinking. She might be because of all the peeing she did. Hey, don't forget, well, you have a insulin pump. Don't forget, remember I was talking about alcohol being a pure sugar? So that will raise up your blood sugar.
Oh yeah, believe it sounds really funny, but I'm really cautious. I'll take some insulin before I drink, and usually 9 times out of 10 afterwards, my blood sugars are good.
Cheater.
Yeah. Yeah.
Other thing to think about, especially with the hypovolemia, but think about shock. Maybe they have some internal bleeding going on for whatever reason. An aneurysm, again, we were talking about ulcers. And I don't remember if I told you about this call, but I had an elderly gentleman that the cold weather exposure really masked a lot of his signs and symptoms. He had perfusion, but his extremities were cold. And so we couldn't get a good pulse ox. We couldn't get a good EKG. It didn't really show any changes from what I remember. His blood pressure was low, but it's always hard to get a good blood pressure in the back of an ambulance, moving ambulance, especially with monitors. It picks up a lot of that vibration. We get him to the hospital, plop him down. I go to do my report or have a cigarette or something. And along the process, he has bowel movement. And so one thing about a rectal bleed is they smell. For those of you that have had it, you know how bad it can smell.
I've never had it or seen it, but I've heard through other people that it's just horrific.
You're nodding your head, Ozzy. What was your experience?
We picked up this patient hospital, I believe, and we couldn't distinguish what the smell was until we got to our destination. I think it was a nursing home. So once we transferred him from the stretcher to the bed, the smell got a little too
raunchy,
strong. And yeah, that's when we found out. I was getting reports to the nurse, and yeah, she told me that yeah, that's what it was originally there at the hospital for. And yeah, even I can't describe it.
Yeah, it's pretty bad. Well, that patient with that bleed, it smelled, and I had one of my students work there at the ER in Del Sol, and I'm like, follow me. I want to show you something. He's like, did you bring that patient over there? Like, yeah. Oh no. And then he started telling me, or somebody started telling me that that he had a bowel movement, and it was smelling pretty bad. I'm like, no way, it can't be that bad. And I've had another patient that did. And so if you've been to Del Sol, you know how you get to those double doors, and right past those double doors to the right, you have the radiology, and you have where the doctors sit. Well, I wasn't even to those doors yet when I could start smelling it. And he was off in like 26, 25, somewhere over there. It was pretty bad. Anyway, long story short, they ended up doing a CT on him. He had a lot of bleeding internally. He was taken to the ICU, and he passed away 3 days later.
I remember you telling us that story.
And that's where I kind of I felt really bad, but you know, I honestly feel I did the best that I could for him. I started a line. We kept an eye on him. There was nothing that we could have done. You know, Precious, su camita. She's like a little child. She's 11 years old and she's acting like a child. Because I'm not paying attention to her, so she hears noises and she'll go to the door, want to get out and see what it's all about. ¿Verdad? Chamaca. So anyway, so yeah, he died, and I just thought that despite our best efforts, patients are going to die. So, all right. In the secondary assessment, get your vital signs. Look at past medical history, see what they have. Again, looking at medications. There's medicines such as aspirin and the NSAIDs that can cause bleeding, GI bleeding, can cause ulcers. They take them without eating, it's gonna mess up the stomach. Even with Advil, you're supposed to eat before you take them.
It eats up the lining of your stomach.
Yeah. Yep. Now, too much Tylenol affects your liver.
Mm-hmm. But they say you have to do like a large dose, like I don't know, 4,000 milligrams a day or something of Tylenol.
Now, in your medical history, if you have a female childbearing age, ask date of the last menstrual cycle.
Mm-hmm.
Want to rule out pregnancy.
Mm-hmm.
If you can't, you got to stay in that track.
Mm-hmm.
Okay. It could be an ectopic pregnancy. It could be something else. If you're pregnant, you got to think about placenta previa, placenta abruptio. You got to think this is more trauma, but thinking about a uterine rupture.
Mm-hmm.
So get a LMP and find out if they're sexually active. If you have a medical problem with the liver, where are you going to feel the pain at?
In your back,
Nope.
upper right quadrant.
The right shoulders refer pain.
Yeah, but you might feel it in the right upper quadrant. And then also you might have jaundice.
Yellow of the eyes.
Yeah, the eyes, the skin. With cirrhosis, basically the liver is not doing very well. Then you'll have ascites, and that's just fluid buildup due to a backup in the portal veins. How about gallbladder cholecystitis?
Shoulder blades.
Which one?
Cholecystitis.
What was that?
The cholecystitis you would have referring to your shoulder blades, or it also happens after about an hour after you eat. I'm sorry.
Just one.
Just one.
Right shoulder blade.
The right shoulder?
Yeah. Right shoulder and or right shoulder blade. Because remember, the gallbladder is on the right side. So it's not going to affect both. It's just going to affect the right. So the pain's going to start about 16 minutes later. Crampy, colicky pain, uncomfortable pain. What else? Who does it primarily inflict?
Women.
Women? After when?
After they eat.
Eat what?
High processed carbohydrate, fatty foods. There you go.
High fat meals.
Yep.
We talked about ulcers. Again, nausea, vomiting. It's a burning pain. Remember, it's acid right there. So that's why you have that burning pain. What's heartburn?
I think you probably even get a good deal because you're an essential worker. Like nurse, I don't know.
Julio, we can hear you. I don't know what
Oh,
you're saying. We hear you. Huh? Heartburn is where you have the stomach acid going up to your esophagus.
And it can cause erosion also, correct? If you don't take care of it.
Yeah.
And cancer.
Yeah, it can cause throat cancer, right?
I heard it can if it's not taken care of.
Yeah.
I hadn't heard that, but not saying that's not possible. Okay. So yeah, that's what heartburn is, and the medical term is GERD, gastroesophageal reflux disease. That's heartburn. What about pancreatitis? What would you find with pancreatitis?
Mid-abdominal pain.
Okay, what else?
It's caused by alcohol abuse.
It can.
Mm-hmm.
It can be caused by diabetes.
Yeah.
A constant severe pain in the epigastric region, going right through to the back. What's an aneurysm?
Aneurysm? Are you talking about aneurysm in the brain or aortic aneurysm?
Well, we're talking about the GI tract, so.
Okay.
Kind of far from the brain.
Well, okay.
I was gonna say one of these.
Yeah, you'll get a scar. You'll get surgery. Aneurysm is the bulging or ballooning of a blood vessel. It's an abnormal ballooning of a blood vessel. Go ahead, Sherry.
Sorry.
So abdominal aorta or abdominal aortic aneurysm, a AAA, is ballooning of the artery, abdominal aorta. Because it's such a large vessel that if it starts bleeding out, they can bleed out. Not as fast as huh?
Is it going to be signs of shock?
Oh yeah.
But usually if they have a ruptured AAA, you pretty much just say your prayers, right?
Yeah. That's why one patient I had that had a AAA, we took her to Cedars-Sinai Medical Center in LA. This is a big fancy hospital where a lot of movie stars go. So we walked into the ER. They're like, go to the elevators. You're going up to the whatever floor. And it happened to be the surgical floor. Okay. So we go up and they're like, all right, she's going to go to surgery. So I'm thinking, all right, well, we're going to take her over to pre-op, right? And they direct us to a room. And then I realized what room that was. We literally plopped her down on the OR table.
So is the mortality rate very high with AAA?
If it's left untreated or if it ruptures very quickly, yeah. Like Velvet said, you pray.
Okay.
If not, then they can go in there and they can repair it. And they can kind of repair it by. Have you seen movies, like submarine movies, where they start leaking water, and they start putting those tabs? Or I don't know if you were in the Navy, but yeah, they start putting those brackets or whatever. That's pretty much what they do on the artery. They'll sew it up and they'll put one of those, I don't know, stent or something.
Have you ever heard anybody actually recovering from a AAA?
Oh yeah. They just got to watch out for their blood pressure. Waiting for surgery to help repair it. Like I said, that's what they'll do. That was a pretty good CE class that I took years ago on AAAs. I don't think I have the material anymore, but that was a long time ago. And that was in California too. So.
Okay, Lou, I have not a concern, but more of a history than a concern. They had brought in 4 people by air from, I want to say, Okinaga. They had rolled over on an ATV, and there was 4 people on the ATV. It was mom, dad, and 2 kids. While they flew them to El Paso, both parents were DOA, and the sister, I think, had survived, and the little 10-year-old boy was going to get flown over to San Antonio because he had a AAA. My thing is, why couldn't they just operate him here in El Paso if it was with the Children's Hospital?
Because it requires like a vascular surgeon. Cardiothoracic vascular surgeon. So and a pediatric cardiovascular surgeon to boot. Or
we don't have one here, right?
Probably not. If they had to fly him out to San Antonio, probably not. Because you
No,
have
the nearest one is San Antonio, because I remember my niece had like cardiac issues when she was going to be born, and that's where they wanted to send her. And yeah, like other than here, it's only adults, from what I know.
Yeah, there's not a lot of pediatric specialists here in El Paso. And they're trying to recruit pediatric specialists. Like some of you guys know Sable. Her son has a kidney disease, nephrotic idiopathic disease. And it's just, there's something wrong with one of his kidneys. They don't know what. And her choices for nephrologists, pediatric nephrologists, are very small. And she, was it San Antonio she stopped in? Yeah, they had to call his doctor. They didn't have one over there. But yeah, some of the pediatric specialties are very underrepresented here in El Paso. and they are. I know they're trying to recruit as many as they can. But you got to remember, San Antonio has UT? There's a UT campus, and they also have a Texas Tech Health Science Center out there as well. So they're a big medical place.
I know Providence not too long ago. I think they recruited a neurosurgeon.
Regular neurosurgeon or pediatric neurosurgeon?
Pediatric.
Pediatric, yeah. See, there's not a lot of pediatric specialists out here. I mean, they have a lot of pediatricians, but when it comes to specialists, there's not that many.
Yeah, I got flown to Houston. It's a Methodist.
It's a sad story. As far as the care we're going to provide, a lot of it can be supportive care. There's not much that we could do. Oh, another thing real quick with aneurysms. One of the things that we could, advance, maybe not so, depending on their system, but like morphine, patient can get morphine because remember, it's a vasodilator. And it also helps bring down the blood pressure. So there's not a lot of pounding. It's not putting a lot of pressure on that, on those walls, on those blood vessels. In this case, the aorta. Okay. So again, going back, the care is primarily supportive. Start an IV. You got to remember, a lot of physicians, a lot of places, hospitals, they don't want you masking any pain by giving them pain meds. However, like in Sierra Blanca, our medical director, he says, I don't care. Although he doesn't put it as nice as that. He doesn't care. He doesn't want his patients in pain. So even if a patient has abdominal pain, and he's even told me this, if there's a patient with abdominal pain, give him pain meds. Give him fentanyl, give him morphine. I'm still afraid of fentanyl. I'll give morphine. Because the technology nowadays is good enough to be able to diagnose what's going on with the patient for the most part. So, anticipate vomiting, like I said, IV fluids, you want to put them in a position of comfort, which most likely they're going to put themselves in what position?
Lateral recumbent.
Okay. Remember I said the fetal position?
Yeah, they usually have their knees to their
But
chest.
their knees in a lot more.
Mm-hmm.
All right. Abdominal pain, general causes, inflammation or infection, stretching of tissues, ischemia. The stretching, maybe from working out, it's ab day. You overdid it. Maybe you start doing sit-ups to get into shape, and it's just not working. Because to get into that beach bod or that summertime bod and that Speedo thong, or as Eric would put on one of those, that bathing suit that Borat wore, or Borat. Oh, sorry, Eric, I forgot. I wasn't gonna say anything to anybody, but you look cute in that outfit.
Who's
I think after this quarantine, nobody's going to be going out in their little bikinis in the summer.
What were you saying, Eric?
I have no idea, Lou. I just walked in and I thought I heard my name.
Because I saw you here, although I didn't see you on camera because you don't have your camera on.
Oh, I'm sorry. My wife called me. I just went next door to the room.
But we were saying, have you seen that swimsuit that Borat wore?
No. What's that, Lou?
You gotta. I'll Google it.
Oh, no.
What?
Come here, mommy. Come here. No, Toby. No.
Oh, fuck
There you
yeah.
go. There you go, Velvet.
I'm in.
Wait,
And
let
that
me
reminded
look this up.
Ew.
the dude stacked.
It's covering the nipples.
That dude stacked.
And
And
character
that reminded
in the thong style and non-thong style.
you of Milu?
Yeah.
Okay, cool. Take that as a compliment. That dude's pretty, telling you, can't hate on him.
It's a mankini. See, there's a thong.
Oh my god, he has no ass.
It's a mannequin.
Oh my god.
Oh, here you go, Sherry. You'll like this one.
Yeah. Well, I mean, I like the chest. Yeah.
Small package, though.
He's a little thin.
It's a little tea bag.
He's a little too thin. He's got to have that dad bod. Oh, okay. That's yeah.
The mankini.
If we have a warm Halloween, I'll get that, Lou.
Okay.
But I'm not very hairy though. I might have to like freestyle it.
Oh my goodness.
What's a hiatal hernia?
It's a bulge in your intestine.
The stomach, right?
The stomach. And
it goes up towards your esophagus.
Does it have to do with your diaphragm?
okay. So it's your diaphragm and your stomach. What about it?
He gets strangled.
Okay. So basically, a piece of your stomach goes through a tear in the diaphragm, and it becomes strangled. And now part of the stomach can get ischemic. All right, other disorders, pain, you have bleeding, you have burning in the upper quadrants, as we've mentioned, severe pain, vomiting blood, cough and ground episodes, melena. Then we have appendicitis. I'm trying to remember the heel drop test for appendicitis.
Yeah.
And then we've always learned that it's pain in the right lower quadrant, right? Now, the other thing though about appendicitis is that you'll also have pain over the periumbilicus area, so around the belly button. And you'll have rebound tenderness. In other words, when you let go of the pressure is when the patient's complaining or, feels that pain after you let go. So that's rebound tenderness. All right, gastroenteritis, it's an infection or inflammation of the intestines caused by an infection. What's diverticulitis?
Inflammation of the spleen.
Isn't it blockage in the intestine? Little blocks of feces that are caught. It causes inflammation.
Okay. Where is it caught?
On the, isn't the lower left side? No.
Diverticulitis are small pockets within the intestinal wall. And so, yeah, you get food and other things trapped in there, and then they can get inflamed if they don't come out.
Or infection.
They can get an infection as well. Now, one thing I heard of, and it kind of makes sense, but you know, this came from a reliable source, is that eating popcorn helps clean out the diverticuli.
No.
Interesting.
Now, another thing that could happen is they call it volvulus of the small intestine. Basically, part of the small intestine is twisting on itself, strangulating it. And that area can become ischemic. One of the Bee Gees died from something like that. It had twisted, his small intestine twisted. He had to have surgery to repair it. However, he died on the operating room table. So something else happened.
So it's called a volvulus?
Yes.
Is a volvulus similar to intussusception?
To a what?
Intussusception.
What's that?
Intussusception is the telescoping of the bowel or itself.
Yeah.
Thank you.
You're welcome. Other disorders, inflammatory bowel disease, there's irritable bowel disease or disorder. It's a condition where they constantly have to go to the bathroom, number 2. You Velvet, make it too much.
Please. That's some good ice.
I can't even hear myself yawn. What else? Inflammatory bowel disease includes Crohn's disease, and again, ulcerative colitis, only because colitis pertaining to the colon, inflammation of the colon. Crohn's disease can affect any part of the GI tract. Usually with Crohn's diseases where people are gluten intolerant. You have to eat gluten-free foods. Can you, not you specifically, can you swallow something and then later on poop it out?
Yes, but it also depends on what items you're going to be swallowing.
All right.
If you swallow glass, no. If you swallow a nail, no. That has to be taken out by surgery.
Okay. What if you swallow a quarter but you poop out 2 dimes in the nickel?
Really? No, I mean. Sherry, quit yawning. Really?
It's way too early for my bedtime too. I won't go to sleep right now.
What's Great Turner sign versus colon sign?
Gray Turner signs is ecchymosis of the flanks, and the colons is paraumbilical ecchymosis, which means discoloration.
Okay. It's going to indicate what kind of thing. You're right.
The Gray Turner is internal hemorrhage, right?
Okay. And the other one?
The other one is going to be with severe pancreatitis. Yes. No.
Yes. As far as with pancreatitis, yeah, it takes about 24, 48 hours to appear. And it can predict acute pancreatitis. Gray Turner's, the bruising on the flank, can be indicative of pancreatic necrosis with retroperitoneal or abdominal bleeding. Very, very good.
Cherry.
You what?
Cherry Johnny.
Quite a Sherry.
I'm sorry. I'm trying to behave.
So when it comes to abdominal injuries, we really have to really think about what's going on. We have to gather as much information as possible. Remember, most everything we do, most everything we do is based on supportive care. There's not going to be a lot of stuff that we could do. Okay. Just ask the questions, rule things out. That's the best advice I can give you. Just keep asking your questions and rule things out. Okay?
Yes, sir.
All right. So it's 10 o'clock. So I just wanted to summarize Saturday. So for those of you coming in the afternoon, take it before. If you haven't taken it when you get there, you can be taking the test. Okay. You'll take about the first part of the class of the 3 hours doing skills. So, and again, you don't have to be there if you don't feel comfortable going. But we will be checking you. You will be wearing your mask. You will be wearing your gloves. Okay. So, anyone have any questions?
No, sir.
No.
When are you guys gonna let me know about the groups for Saturday? I saw messages already going through. What was that?
How many of us can be per group?
8. So, Mr. Dominic, what do you have for me so far on that? Well, I guess he doesn't have anything, so.
I think ask Ruben. Ruben had something earlier. He sent it in the group chat. I thought.
I put something on the group chat, like
Yeah.
I put some names on it. Like I come like the first come first serve, so like look on the group chat. You know what I mean? Like I see on the morning is Luis, Sherry, Velvet, Victor, and there's like 4 spaces. On the afternoon it's Eric, Dominic, Ossie, Arturo, Julio, David, Ruben, and Ashley. So yeah.
Can you put me down for the morning?
Oh, yeah. What's your name? Oh, who are you?
Jasmine.
Oh, Jasmine. Okay, got you.
Not-
So for those of us coming in the morning, you want us to, we'll do the test when we get there, right?
Yeah.
Okay, cool.
I mean, I'll open it for tomorrow evening. So if anybody wants to take it tomorrow evening, but I know Sherry's gonna be busy with her best friend, Fire Devil.
No, actually, if you're gonna open it tomorrow, I'm gonna take it tomorrow night.
So
What time will you open it tomorrow?
6. No, make it 4. I'll open it at 4.
Well, yeah, I'll take it tomorrow then. And it's 20 through 24, correct?
Yeah.
Okay, cool.
Questions?
No, sir.
The homework is for tomorrow or like for the day
Saturday. Homework will be due Saturday.
at the end of Saturday or before doing the test?
Before.
Should be before. I thought I clarified that the last time.
Yes, sir, you did.
Okay, just to make sure.
Any other questions?
No, sir.
Sir.
Alrighty then. Well then, I will see you guys on Friday. I hope you guys are excited about going to practice.
Mm-hmm.
Sir.
And I think that's it.
Okay.
Good night, guys.
All right. You guys have a great. I will see you guys on Saturday.
Good night.
Good night.
Good night. Good night, Joseph. Good night.
Bye. Good night.
Night, John Boy.
Oh, it's funny.
Like.